Hi, everyone. I'm Dr. Samantha, the maternity mentor, and welcome back to another one of our live Q&A sessions that we have here every Monday at 9 p.m. Eastern Standard Time. This is a chance for you to go ahead and to ask any questions that you have for me live. You can put those questions into the chat. This is also a chance for me to answer any questions that you may have submitted this week on Facebook, Instagram, Twitter, or on our videos in the comment section. Please remember to hit the subscribe button on the channel. It really helps me out, and I really appreciate it. Also, make sure you hit the notification bell. That will allow you to get notified when we post our new videos. You can follow us over on Facebook, Instagram, and Twitter. Those will be linked into the description. Please share the channel with your friends and family, and we really appreciate all of your support. And for those of you who stick around till the end, I will give you a sneak peek at tomorrow's video that will be going live. Again, I really appreciate you guys being here. If you have any questions, please feel free to put them into the chat. In the meantime, I'm going to go ahead and get started with some of the questions that we have gotten on the videos this week. So we actually had a lot of really good questions. I'm going to start out with bleeding. This is one of the #1 concerns during pregnancy, so I always like to start out with it. I had a question. I'm 8 weeks pregnant today, and I just saw pink spotting when I went to the bathroom and wiped. I know I have a small subchorionic hemorrhage and that's bleeding internally. Am I having a miscarriage? So one of the things that can cause bleeding during pregnancy that's actually considered normal is a subchorionic hemorrhage. So a subchorionic hemorrhage is a collection of blood underneath the placenta. So you have the uterus, the placenta attaches to your uterine wall. This has a whole bunch of blood vessels, and the backside of the placenta has a whole bunch of blood vessels, and these are what's going to fuse together to help feed your baby. Sometimes one of these blood vessels will kind of have a little burst. And so what you get is a small pooling of blood. And that pooling of blood, sometimes you'll get some spotting from that you'll see externally. That's actually considered normal. And subchorionic hemorrhages in the beginning can be very scary because earlier in your pregnancy, the hemorrhage will actually be larger. And as your pregnancy progresses, it will actually get smaller. This is not because the hemorrhage area actually gets smaller usually. What it is in the beginning, your placenta is small. And so the hemorrhage will take up more space on that placenta. But then as your pregnancy goes along, the placenta gets larger. So that same hemorrhage is now smaller in size, plus it will sometimes resolve. Now, there are other reasons why you might have bleeding during the first trimester. Those can be like the pregnancy hormones can thin out the vaginal tissue. So if you're having sex, if you have any kind of like irritation from an infection, like a yeast infection or a urinary tract infection, if you have hemorrhoids, these can all lead to spotting. The most important thing is you want to make sure you're letting your healthcare provider know right away, because unfortunately, you could be having a miscarriage, which is one of the things that women are very concerned about. Another question that we got this week was, I'm 8 weeks pregnant and I have no heartbeat and I'm experiencing light spotting. Please help. Now, this is extremely sad. And unfortunately, this may be the start of a miscarriage. But the thing is, we can't assume that without getting assessed. Now, this person had to have gone and gotten an ultrasound in order to determine that there was no heartbeat. But early in pregnancy, even if you do get an ultrasound, they're not always accurate. Those ultrasounds are extremely variable to a lot of situations, including even the tech themselves, if they have proper training to look for things. So if you have been stable, even if you had an ultrasound that showed no heartbeat, if you start to see spotting, you want to let the healthcare provider know so they can reassess the situation. Additionally, if you are having a miscarriage, you need to make sure you know how to take care of yourself. You need to know the signs of infection. You need to know when to come back. Because, for example, a miscarriage could be the result of an ectopic pregnancy, which can be a medical emergency. So no matter what the situation is, you want to make sure that you are checking in with your healthcare provider. Sometimes we will have a miscarriage that does not pass. So this means, unfortunately, the baby does pass away inside the uterus, but the baby does not pass out externally. This sometimes requires us to give you some kind of medication or for you to have a D&C, which is a procedure to scrape out the uterus to make sure the pregnancy, the pieces of the pregnancy that are left, like the placenta, come out of your body, because it's unsafe if it stays there. It can cause infection. So it's very important also that you make sure that your healthcare provider knows what's going on so they can make sure that you are healthy throughout the process. Now, we got another question that said, I'm 19 weeks pregnant and I'm having a severe UTI with spotting. However, at 9 weeks, I had mild PV bleeding. Now, I'm not sure what they're referring to with PV. I'm thinking they meant vaginal, but it's kind of irrelevant. This is a really good example of why we need to contact healthcare providers. I know I say this over and over, but bleeding is one of those things I need to nail this in with you guys. So this person had bleeding at 9 weeks. That bleeding at 9 weeks can be caused by a completely different thing than bleeding at 19 weeks. So she is mentioning that she has a urinary tract infection. Urinary tract infections are one of the most common infections during pregnancy. They're one of the most common reasons why we give antibiotics during pregnancy. And they're one of the most common causes for miscarriage, preterm birth, and some pregnancy complications. It's a very serious thing. If you have a severe urinary tract infection, it can go to the kidneys and you can see blood in your urine. You can see blood on the outside because you're very irritated. Plus, it can lead to infection in the uterus, which could also cause bleeding. So this urinary tract infection needs to get treated. This bleeding has nothing to do with the 8-week bleeding. I'm like 99% sure of that. The 8-week, 9-week bleeding was probably caused by something entirely different. The reason why this is extremely important for you guys to understand is, let's say you have bleeding, you're 8 weeks pregnant, you see some spotting. You go to the hospital, they do an ultrasound, baby looks good, blood work looks good, they don't see anything, spotting resolves. A week later, you see bleeding again. You need to get it checked out. Well, let's say a week later, they see a subchorionic hemorrhage on ultrasound. So now they're like, oh, we think the bleeding from before was this subchorionic hemorrhage. It should resolve. Don't worry. And a week later, your bleeding resolves. And then a week later, you have bleeding again. You still need to go back and get checked, because now this third set of bleeding, this could be caused by an infection that just happened to arise at that time. If we leave certain causes of bleeding untreated, it can lead to significant complications. And that's why we want to make sure you guys are getting assessed all the time. Now, the last thing I'm going to say, and then I see we have a question in the chat, is that your healthcare providers have signed up for a 24/7 job. This is what they do. They are there to help you no matter what time of day or night. If you can't reach your healthcare provider, your local hospital is also there. Please don't feel stupid or silly if you want to get checked out and make sure you and the baby are okay, because this is what matters and this is what's most important to a healthy pregnancy. Okay? So that was a great question. All right. So, Obapa, please, I want to know immediately, if you found out you were pregnant, how are the sleeping patterns, or does it matter? Okay. So I believe I understand what you're asking. I do know that there's probably a slight language barrier. So if I don't answer it, please tell me and I will just rephrase the question. I believe what she is asking is, once you find out you're pregnant, how do you need to change how you sleep, and maybe how much sleep you get? So the answer is probably not. So I'm caveating that because it depends on how your sleep is to begin with. Once you find out you're pregnant, the most important thing is for you to be healthy. This means make sure you're getting plenty of fluid. Make sure you're eating a healthy diet. Make sure you're walking and getting exercise if you're able to. It also means that you need to sleep well. Sleep is the number one thing that day in and day out in my practice, I talk to patients about. Without proper restorative sleep, our brain can't rest to be able to function at its highest amount the next day. Our circulatory system needs that rest, needs that calming down period for us to just feel better and healthier overall. So that means we need to sleep well when we're pregnant. If you right now sleep well, then you probably don't need to change your sleeping patterns at all. But if you're not getting good sleep, now is the time to talk to your healthcare provider and see what changes you can make in order to sleep better. Some of the things you can do is you need to understand that we are cavemen. And what I mean by that is our body responds to many different things like diet and sleep based on how we used to be when we lived in caves. And when human beings lived in caves, our sleep was our sleep patterns and our sleep hormones that we make in our body were completely mediated by a couple factors. Number one, light. When it became dark, our body got the signal to make melatonin. We make our own melatonin, in case you didn't know that. This is a hormone that boosts our immune system and helps us to feel sleepy. So when the dark came, we started to realize it was time for bed. And when the light started to arise again, when the sun came up, our bodies went, oh, it's time to wake up. Additionally, at night, again, we're in that cave. Not only is the light going away when the sun sets, but also the temperature drops. So one of the most essential things you can do in your house is to drop the temperature in your house by 2 to 3 degrees. A lot of people don't realize this. And one of the things with this is, let's say you keep your house pretty low temperature, like say 72. Even if that's a very low temperature for your house, you should drop it to 70. And even if you use an extra blanket at 70, believe it or not, that's better for you to sleep. The reason is, if you think about us in caves, when we got cold, we would just bundle up more. So putting on an extra blanket is okay. It doesn't counteract the effect that dropping the temperature has. Then in the morning, when the temperature is rising again with the rising sun, your body's like, oh, wait, it's time for me to wake up. It's time for me to get going. So these are two very important things. Now, the other thing is, we all hear about sleep hygiene, turn off your phones, turn off your TV, no light. This is very true. A lot of that has to do with the stimulation that comes from the blue light spectrum that's in all of our electronic devices. One of the things you can do is, if you sleep with any lights on in your house, that needs to change. A lot of us have the air fresheners that have the night lights in them. We have other night lights. All that needs to go. If you do need light in your house because you have small children or you just need to be able to look around, what you want to use is red night lights. The red light spectrum helps trick your brain into thinking it's asleep. Once your brain gets exposed to these bright lights from, like, say, your bathroom light or something like that, your brain goes, oh, it's daytime, the sun is up, no more melatonin. And then you're awake in the middle of the night. But if you have a red night light, your brain thinks it's asleep, even if you're walking around wide awake. And so as a result, it keeps producing melatonin, which can help you get back to sleep faster. So make sure, if you do need light, that you go ahead and you use a red night light. Now, OBAPA, sleeping positions. So in the beginning, so I would say up until about 16 weeks of pregnancy, usually most women can sleep however they want to sleep. However, after that time, you start to have a belly, and this heavy belly is pulling on your back, okay? And that can cause a lot of back pain and fatigue. And you're also putting weight onto your hips and your knees. And that hormone relaxin, which is relaxing all of your joints to allow for your pelvis to eventually stretch for a vaginal delivery, that's now causing all these joints to kind of spread and ache as well. So once you hit about 16 weeks, it's really good to start using a pregnancy pillow. And I have a couple videos, which we'll link into this description, about first, second, and third trimester must-haves. And I think it's on my first or second trimester must-have. But a pregnancy pillow and or a body pillow, you don't actually need to buy one of those fancy pregnancy pillows, or standard straight body pillow will do. What happens is you can lay on your side, and it will help keep your pelvis tilted so you're not laying directly on your belly. You can also then put it in between your knees, which will help align your spine. And this can be life-saving as far as getting good quality sleep. But additionally, once you get to 20 weeks, you cannot lay on your back. So one of the things that happens is we have a major vein and artery going down the center of our body, and then it splits at your hips to go down your legs like this, okay? And that vein and artery cannot be compressed. So once you get, if this is your back, okay, it's going down the center, right? Well, once you get that big, heavy belly on the front, okay, if you lay flat on your back, that baby pushes weight onto that vein and compresses it. And then your circulation is all messed up. And one of the things that happens is the baby doesn't get enough blood either. So it's not just affecting you, it's affecting the baby. So therefore, once you hit 20 weeks, we do not recommend that you sleep on your back anymore. Additionally, you can't sleep on your stomach anymore. It's not comfortable and it's not good for the baby. So this leaves us on the side. Now, for those of you guys who are early in pregnancy for sleep, believe it or not, another thing you can do for sleep early on is practice side sleeping. So as you get further and further along in your pregnancy, it's going to become harder and harder to sleep. You have to get up to go to the bathroom, you're achy, just different things. And if you normally sleep only on your stomach or only on your back, transitioning to side sleeping when you're exhausted and cranky and achy is just terrible. So if you can practice now learning how to side sleep with a body pillow, I think it's also amazing. I hope that answered your question. This week we got tons of questions on antibiotics, which I love. So I'm going to ask them all at once because pretty much it's the same idea. Is this okay? And I'm going to tell you a little bit about antibiotics. So I had a question about, is moxifloxacin safe during pregnancy? Is cephalexin at 500 milligrams a day safe? I had a patient ask if amoxicillin is safe. And then I'm 9 weeks pregnant and I have cystitis. My doctor prescribed cefuroxime oxidil 500 milligrams. Is it safe? So cystitis is an infection of the bladder that kind of goes along with a urinary tract infection. Urinary tract infections are like the number one infection. So antibiotics, let's talk antibiotics 101. Antibiotics are used to treat bacteria, not viruses. Last week I had a question about somebody who had like a sinusitis, which is like an infection up here. She was asking about an antibiotic. And one of the things I said is, well, make sure it's actually a bacteria. Because if it's viral, which is most sinusitis, you don't want to take an antibiotic unnecessarily. Cystitis and urinary tract infections are 99% of the time caused by bacteria. Once you're prescribed an antibiotic and you determine it's safe and you decide to take it, you need to take it all as directed. Let me repeat that. You need to take it all. So antibiotics are awesome because within like 24 hours, you feel way better. You feel like amazing, to be very honest. And so the thing is, pregnant women, we're trying to protect babies, right? And so we don't want to put anything into our body that we think might harm them. And oftentimes the mentality is less is more, right? So I'm feeling better. Let's not use any more than I need. Well, the thing is with antibiotics, here's what happens. Think of the bacteria as like an army, okay? So you have a whole bunch of bacteria just waiting there to fight this war against the antibiotic. And what happens is that antibiotic comes in, right? And it starts taking out some of the bacteria. But these guys in the back, they're watching what that antibiotic does. And they're figuring out how to get around that, what defenses they can build. So you come in, you start taking out the bacteria, and you feel better. So you're like, I don't think I need this anymore. And you stop. Well, what happens is all those guys in the back are like, I know how to defeat this antibiotic. They build up defenses. Okay. So now a couple days later, you don't feel good again because it didn't actually kill all these guys. Because not only have these guys built defenses, they've called in reinforcements. So now there's more of them again. So now you feel bad. You're like, oh my God, I'm getting sick again. Let me take the antibiotic. Let me finish it up. Only this time, the antibiotic doesn't work because these guys had a chance to call in reinforcements and build up a wall. And now you're stuck taking the rest of this medication, which doesn't work. You end up having to go back to your healthcare provider, who now is forced to pick a stronger antibiotic. And eventually, over time, the antibiotics have more and more risks. However, if we don't treat the infection, there's a risk of miscarriage. So we want to make sure that we balance that. So if you're going to take an antibiotic, please take all of it as prescribed. So cephalexin, cefuroxime, and amoxicillin are all safe to use during pregnancy in all 3 trimesters. Now, moxifloxacin is going to be a different story. So, moxifloxacin on itself has no data to say that it is harmful for you or your baby during pregnancy. However, it is part of a category of antibiotics that are called fluoroquinolones. Fluoroquinolones, as a group, have been shown in some cases to cause some musculoskeletal defects in babies. It depends on a lot of factors, including where you are in your pregnancy, how long you're going to be needing the medication, etc. Fluoroquinolones are stronger antibiotics. This is the exact scenario that I was telling you about as to why it's so important if you're prescribed something like the amoxicillin, which is a far safer medication, that you want to take all of it as prescribed, because you don't want to end up on this other end where you're having to take something stronger. That being said, if we're trying to fight an infection that's very treatment resistant, I would strongly urge you to take this medication if you've talked with your healthcare provider about all your options and the risks versus the benefits, because I have seen more cases of preterm labor and miscarriage due to infections that are left untreated. So I definitely encourage you guys to talk with your healthcare provider and don't just assume it's not safe because it's something that you need to have that discussion. Hi, Jessica. On social media, I've seen a lot of posts geared towards pregnant and postpartum moms about adrenal cocktails. The posts suggest that they help with brain fog and energy levels. Have you ever heard of these kinds of recipes? Is there any truth to the claim about energy and brain fog? So, adrenal glands are glands on the back of your kidneys that secrete basically amphetamines. So, amphetamines are stimulants, and there are very natural forms of amphetamines that we create in our body that are normal. And they do mediate to a certain extent energy. I would say that energy does go hand in hand with brain fog. The amphetamines don't necessarily, I think, affect brain function, but the fact is, if you have more energy, you're likely going to feel less foggy. So adrenal cocktails absolutely could potentially have benefits. However, your adrenals are submitting or are putting out hormones. These are still hormones. And what I will tell you, for all of you guys who are thinking about this stuff, we have to be very careful about some of these supplements that they have over the counter. So for starters, none of the supplements in this country are FDA regulated. This includes probiotics you give your baby and prenatal vitamins. So we look at these things. You need to take a prenatal vitamin. Probiotics are fantastic for your baby. Vitamin D is fantastic for your baby, but these are not regulated substances. So nobody's going into the factories and looking at the production process, looking at what they're using for supplies. None of that's happening. So when you're talking about some of these cocktails, now you have to wonder, what is the evidence base that they're using? What are the actual ingredients that they're using? How did they come about this? And unfortunately, a lot of this stuff is not really monitored for its safety effects. I had a patient a couple years ago who came to me telling me all of a sudden her testosterone level had just gone through the roof. And she had figured it out because she was extremely angry and stressed and having a lot of issues with that. And she happened to have her PCP who tested her testosterone level, but they couldn't explain why. Well, she came to me, and I happened to know she was really big on supplements. So I said, bring me your supplements, because I'm sure you've changed them. And she had 4 supplements, 4 that increased testosterone production. Now, for those of you who might be wondering, one supplement that helps with testosterone production, and yes, women do produce testosterone, is zinc. So zinc is extremely beneficial for men's health. For women's health, at regular doses, it's extremely good for us and needed because it helps with our immune system and other things. However, men can tolerate a much higher level of zinc than women can, because one of the effects it can have is to increase testosterone levels. So if you don't know what's in those and what their effects could be, not only with your medications, but with your other supplements, what seems like it might help might actually be harming in some other way. What I would tell you, Jess, is I would potentially pick out one of those adrenal like cocktails and send that to your provider and have them look at the ingredients and let you know whether they think that's good for you. The final thing is for any of you guys who are potentially doing this while you're breastfeeding. So pregnancy, you definitely need to get it cleared. When you're breastfeeding, I would also encourage you to get it cleared because you don't know what of those substances are crossing over and getting to the baby, and you may not want to increase your baby's adrenal function. So that was a good question. Okay. So I had a question on depression and depression meds. So it said, "Hello, ma'am. I had my transfer yesterday, and my doctor has given me alprazolam 0.25 along with other meds and injections. I just wanted to ask if I take this pill or can I skip it?" Okay, so alprazolam is the other generic word for Xanax. Xanax is a benzodiazepine. This is a class of medications that treat anxiety. Benzodiazepines have a lot of very negative effects. Amongst others, they can be highly addictive. If used excessively for long periods of time, they can lead to dementia and Alzheimer's. I'm not a fan of Xanax or any of the other benzodiazepines. I try very hard to avoid it. I think it goes down a very slippery slope for a lot of people. What I will tell you is, though, this person, she mentions a transfer. So she must have experienced an IVF transfer. This is in vitro fertilization. She had a fertilized egg transferred into the uterus, hopefully to end up with a positive pregnancy. So this is an extremely stressful procedure and an extremely stressful time. If you're going through IVF, that means that you've had some kind of fertility issues. Infertility can be very, very hard on a person. And the thing is, when you have a lot of anxiety, that can actually cause you to release stress hormones, which can make it actually harder for you to maintain a pregnancy or for that transfer to be successful. So treating anxiety is extremely important. Now, to be clear, Xanax and the other benzodiazepines are contraindicated during pregnancy. Period. End of conversation. There's a lot of reasons why you shouldn't take it. However, it's usually more has to do with the baby and the effects on the baby long term, but not because of birth effects. There's not a lot of data to say that Xanax or any of the others would cause a birth defect. So in the short term, if your IVF doctor has assessed you and really looked at the entire situation and feels like your anxiety is so extreme that it might interfere with the successful transfer, and they feel like a little bit of Xanax, and just so you know, 0.25 is the smallest dose of Xanax you can get, I would suggest that you follow their plan of care. If you were concerned, you want to go back to them and make sure that they tell you again what the risks versus benefits are. But I'd especially focus on the benefits. Why are they telling you to take it? But for a very short period of time, if it's recommended by your healthcare provider, I might do that. But once you are absolutely sure that you're pregnant, I would not continue that medication. We had a question on our hemorrhoids video. It said, "Can I take Daflon 500 milligrams as I have severe bleeding?" Okay, so Daflon is a medication that's used to treat hemorrhoids. So this is a medication that's not used in the US. So unfortunately, this is not a medication that I can say for sure is safe or not safe. So this is a really good kind of example of what do we do when we're not sure. So when I tell you guys about safety, I'm referencing a guide that we use here in the US and it's used in other countries that aggregates data to tell us about safety. So it looks at animal studies primarily. We can't study these medications on pregnant women or breastfeeding women, but it also looks at data that's been collected from women and their healthcare providers when they use medications. Additionally, it takes into account molecule size, fat solubility, half-life, etc. and it puts it all together with a risk scale. And this is one of the ways that we can learn about how and when a medication is safe. Now, your healthcare provider should also know these things, but if you really do want a second opinion, another option is to go to your pharmacist. Your pharmacist has specialized training in medications. They have been trained what medications interact, what's safe for pregnancy, what's safe for breastfeeding, etc. So if you're ever not sure, or you really want to have a secondary discussion again on risks versus benefits of a medication, your local pharmacist can help with that. Okay. For those of you who are joining me, welcome, welcome. I'm Dr. Samantha, the maternity mentor. We're here for our live Q&A session. Please feel free to put any of the questions that you have into the chat, like some of our other people have been doing. And at the end, I'm going to give you a preview about what video is going to be posting tomorrow. So we had a question on RH, the RH factor. So hi, in my case, my blood group was changed from negative to positive, which really affected me. I am RH negative mother, and my baby's blood group was O positive, just like his father. I have not been able to get pregnant again for the past 5 years now. I recently got pregnant after 8 weeks and I had a miscarriage, and still the RhoGAM was not given to me. So what will happen to me? So RH factor is the rhesus factor, okay? So we have 4 blood types, O, A, B, and AB. Attached to those is positive and negative. That positive and negative is the rhesus factor. And that came when we studied and learned about blood types from rhesus monkeys. But basically, it's 2 different types of blood. Now, if you have RH positive blood, your body seems to react normally no matter what happens, okay? But if you have RH negative blood and you get pregnant with an RH positive baby, which you can if your partner has RH positive blood, what happens, your blood detects that positive blood as a foreign invader, and it develops antibodies and can actually attack your baby and your pregnancy, which can lead to different complications, including miscarriage. It can also lead to issues with getting pregnant again. One of the ways we do this is we give you, or to fight this, is we give you a medication called RhoGAM. RhoGAM is a shot that should be given around 28 weeks or so. And then after your baby is born, we test the baby's blood. If the baby is positive and you are negative, we give you another shot. So she's referencing a miscarriage. After every miscarriage, you should also have the shot because we don't know if the baby was positive or negative blood type. Now, if you have not received the shot, you can go to your OBGYN and ask them if you can receive the shot at a later time. Sometimes they will do that for you and sometimes they won't. After that, unfortunately, the only thing you can do is to keep track of your history. And if you do see a high-risk specialist because you're having trouble with getting pregnant, they may recommend further treatment with a hematologist. But unfortunately, that very rarely happens. And it's just something that you kind of have to work to see if there's anything else they can do for you. But unfortunately, there's not much else past that. So definitely know your blood type, guys. And if you were to have any kind of complications, keep asking for RhoGAM if you haven't received it. So Elsie, I am so glad you are on. I have not answered your question yet, and I thought it was an amazing question. I'm so ready for this. So in the chat, she says, I'm having a C-section scheduled coming up. I was curious how I'm going to deal with it. My hospital only gives out NSAIDs for C-section and recovery. Is Tylenol going to give me adequate pain relief? The protocols have changed. Okay, so for any of you guys who've had a C-section, C-sections are major surgery. And actually, I'm assuming your name is Lauren from your YouTube name, but Lauren really mentions that she had a rough time of it last time. So I have a ton of videos on C-sections for those of you who might be getting ready to have a C-section. Please feel free to check them out. It goes into a lot of these different pieces of it. But given that she's already had a C-section, she understands what it was like. So for starters, the way the C-section, if you're having a planned C-section works, is once you're checked in, they usually give you a spinal anesthesia. So it's like an epidural, but it's in a slightly different space in the back. And once it's in, usually they use something that's a combination of an opioid, which her hospital is no longer using, along with most of the time Marcaine, which is also called bupivacaine, and that's like a lidocaine. It's like a numbing agent. Now, a lot of these spinals, they're starting to combine with other things, or they're just using like a lidocaine only type of spinal. And these are super effective during the actual surgery. But what she's referring to also is like what happens afterwards. So now there's something called ARIS. And ARIS is a anesthesia protocol that they're now using in the hospitals. And actually, I printed it out because I want to make sure I say it exactly accurate. So ARIS is enhanced recovery after surgery. And so many hospitals are picking up on this. And I actually was using it in the hospital with patients, and I found that it's extremely effective. So normally we tell patients nothing after midnight. You can't eat or drink. But that has changed with ARIS. And one of the things that's changed is they're now telling you to drink Gatorade. And usually our hospital did, So our hospital did Tylenol, and they told the patients to use a specific amount of Tylenol. But other hospitals are also using gabapentin or Celebrex. So your hospital may be different. And they'll tell you, like if your surgery is, say, at 9 a.m., they may tell you like 6 hours before that, you're going to take whatever this medication is. And they're going to stress to you, drink all the Gatorade. Make sure you drink all of the Gatorade. So these protocols found that women that had this dose of electrolytes along with this medication proactively up front had a significantly improved pain relief post-op. Okay. Now, when you're in the recovery room, they are very likely going to give you medication proactively. Now, one of the things that you say here, Elsie, is that you mentioned the NSAIDs and Tylenol. So those are actually two different medications. So NSAIDs are non-steroidal anti-inflammatory drugs. So those are stuff like ibuprofen or Motrin. Tylenol is in a completely different category, but they both treat pain and they both treat it differently. So this is why we give those to everybody together. And then usually they continue to follow this protocol by giving you these medications, not when you say you're in pain, but at a scheduled time. I encourage you to do it exactly as they are telling you, because this has been shown to not only be extremely effective pain relief, but additionally, it lowers it shortens your recovery time by sometimes a week or two, because that's how effective this is. Because the pain relief is so significant that you're able to move around and start doing things faster. Now, if you have breakthrough pain, there should be something there available for you to take. I would also encourage you to ask your OB ahead of time about using lidocaine patches or lidocaine cream on your C-section incision. You will need to know how to do that properly, but I would absolutely encourage you to ask about that. And I found that the ARIS protocol was absolutely fantastic. Now, the only other thing, which your hospitals probably aren't going to be happy that I'm going to tell you, but there is an IV Tylenol. So the IV Tylenol is called Oframev. I hope I'm saying that right. Oframev. You would think it was like taking like Percocet. It is absolutely one of the most amazing drugs out there. Most women will tell you that it is one of the most effective things they've ever taken for pain. And it is seriously just Tylenol. The only difference is it's given through an IV. Most hospitals don't want you to know about it because it's extremely expensive. But I'm telling you, this is something that you should talk to your healthcare provider about as potentially something that could help if you are really having severe pain. And if you advocate, they might be willing to give that to you in the recovery room instead of the oral Tylenol. Okay. I'm so glad that helped us see. That was such a good question that I was so excited to actually get it, because it's something that we don't talk about a lot. Maybe I'll do a video on ARIS because it's a really good protocol. Okay, so I had a question on the keto diet, which is one of my favorite things. Is nausea during pregnancy a signal to stop eating and allow ketosis? Absolutely not. Okay. So, for those of you who aren't aware, I am very much a proponent of the keto diet. I think keto is extremely, actually intuitively natural and actually follows kind of what I was talking about earlier about us being cavemen. When we were in caves, what did we eat? Primarily protein and healthy fats. Healthy fats mostly being either nuts or fats from animals. Additionally to that, we migrated. So as we migrated, we would eat whatever we came upon. So we ate lots of berries. Okay. If you look at keto, those are the staples of a ketogenic diet. We didn't eat grains. We didn't eat any of these processed foods. We didn't eat a lot of the fruits and vegetables that you see in the stores nowadays. These didn't exist for us. So following what we would have naturally ate is actually so much better for us at a genetic level. And a lot of people have reduced inflammation, reduced risks for depression, anxiety, improved memory, improved cognition by eating what we used to eat as cavemen. Now, one of the things that will also happen if you're overweight is your body will start to burn some of your fat, which is ketosis. And some people will get something called keto flu, and it feels like the flu. You can get nauseous and achy and different things, okay? When you go into ketosis, even if you're just not pregnant, you don't want to stop eating, okay? You still need to eat. You need to eat a regular, reasonable amount of calories based off keto foods. If you are pregnant and you are nauseous, you do not stop eating. Furthermore, if you are nauseous and you think it's been caused by the ketogenic diet and you think that you've gone into ketosis and are maybe developing keto flu, you actually want to pull back a little bit. Okay. When you are pregnant, you are not trying to cause ketosis. You are simply trying to eat a lower carb diet, which is better for you to help prevent stuff like diabetes and a healthier body. Your goal is not to lose weight during pregnancy unless your healthcare provider has told you to do so. So if you are nauseous, you do not stop eating. Okay, that is not healthy for a pregnancy. And for those of you guys who want more information, we'll link the keto diet into the chat. But I think it's fantastic. So we had a question about drying up milk. And this was a hard question to hear. I lost my baby at 36 weeks, which is 2 months ago. What can I use to dry up my breast milk? So unfortunately, and I'm really sorry if this viewer is on, I'm really sorry to hear that. Unfortunately, this is not something that we talk about a lot, whether it's due to a pregnancy loss or whether it's due to somebody who's had a baby and they're done breastfeeding or they chose not to breastfeed. We don't get a lot of information about drying up breast milk. I have a video on it and I will link it into the description, but there's a couple quick things that you guys can do. So from a homeopathic standpoint, you may read about cabbage leaves online and it's in my video. You take cold, clean cabbage leaves, you put it into your bra and you leave it there until it wilts, okay? That is actually a real treatment to dry up milk. It's been used for centuries. It's very natural. The leaves contain a chemical that will dry up your milk. Additionally, cold helps dry up your milk, okay? Warm stimulates, cold dries it out. You can also go ahead and put cold packs on. You want to wear a bra at all times. You can speak to your healthcare provider about whether you can use Sudafed or Benadryl. These are both allergy medications that are designed to dry you up, so they can also help to dry up breast milk. The biggest thing with Sudafed is it can cause your heart to race and it can increase your blood pressure, so you need to make sure it's okay. And of course, Benadryl can make you sleepy, so you don't want to be driving a car or anything. But you can ask about that. Now, for those of you who go to your healthcare provider, possibly looking for medication, there is a medication that's extremely effective called cabergoline. Cabergoline can be used to dry up milk, and it's extremely effective. You take it for about 10 days, and your milk is gone. Do not take this medication. I hate this medication. I don't think it's properly educated. So let me explain. Cabergoline increases certain hormones in your body that dry up your milk supply. And what happens is those same hormones that it's stimulating, they actually make you feel really good. So your mood will improve. your energy will increase, your concentration will increase. It's actually a really good pick-me-up. And sometimes when you're trying to dry out milk, there can be a little bit of depression and sadness associated with that. So for a lot of women who take this, at first it's like this amazing thing, but you only take it for 10 days and then it goes away. And when that happens, the drop in your mood is significant, and cabergoline has been known to cause postpartum depression. So if you hear of any of your friends trying to take it, if there's anything, I would absolutely have a very serious discussion with your healthcare provider, because there's other things like Sudafed and Benadryl, which do not cause those side effects, as well as some of the things in my video. One of the last things I'll mention that's in my video that I think is extremely effective is peppermint oil. So peppermint oil deodorant can actually help to dry out your milk supply. And it's extremely effective. It can work very quickly and you'll smell good. So that's a good thing. We had a couple questions about incompetent cervix. And I thought some of these were pretty good. So the first one says, my wife is 4 months pregnant and she has a cervical cerclage that was done at 14 weeks. She is now 16 weeks and she is suffering bleeding, sometimes heavy and sometimes light. So a cerclage, okay, so let's talk our cervix, right? So we've got our uterus and at the bottom is the cervix, okay? A cervix, a normal cervix, should be long, thick, and closed, okay? Now, a cervix can't be completely closed, right? Because then how would a baby come out? So it has to eventually dilate. So this little tiny opening that you see here, that's where your mucus plug is. And that's what eventually, when you dilate, that's what will come out. For some people who have an incompetent cervix, this means a cervix that does not stay long, thick, and closed. They will get what's called a cerclage, which is a surgical stitch to help keep this closed. And what we do is we actually just go in and stitch it closed. It looks like you're sewing. Now, unfortunately, the cervix can still try to dilate even if we stitch it shut. So if you start to see bleeding, this is usually a sign that your body's fighting the cerclage, which means you need to go to the hospital immediately, because this can be a medical emergency. Because if your body wins, it's going to kind of rip open the cervix, and that is a medical emergency. So unfortunately, this is probably the body's way of fighting that, and you need to get medical assistance immediately. For those of you who do get a cervical cerclage, they can be extremely effective at keeping you pregnant if your cervix is incompetent. Now, we had another person who just left a comment, but I thought it was a good comment related to this. She left it on the video and she said she was 27 weeks pregnant and her cervix was 1.1 centimeters with funneling. So again, long. So long is a relative term, but usually we see cervixes that are about 5 centimeters. Everybody's different, so we're just going to use. But you definitely don't want to see 2 or 1 centimeter. So when she's saying 1.1 centimeters, she's basically saying that she's only got a little tiny piece of cervix left. Because what happens is, as you dilate, the cervix, which starts out like this, it thins out and then opens, okay? So this part is part of the dilation, right? And then this thinning is effacement. That's one of the numbers they'll give you. They'll say 80% effaced or 100% effaced. That's what that is, okay? So those are the numbers that they are referring to. Now, cervical funneling. What that means is that on ultrasound, they saw the amniotic bag, the amniotic fluid bag, the membranes, they had gone into the cervix, okay? So there's an internal os and an external os. So uterus, cervix. This part at the top is the internal os. This part at the bottom is the external os. So what sometimes happens is, I can't really do it with my fingers, but the top dilates, but not the bottom. And the amniotic bag will slip into here. Okay, so half of the bag will be kind of in this area. That's called cervical funneling. The reason why I like to tell you guys some of these terms is if you hear some of this stuff and you have a better idea of what's going on, it can allow you to understand what's going on, but also to be able to ask questions. Ultimately, the most important thing with women who are having incompetent cervix is to understand what their limitations are and how they should be proceeding. Okay, so I had a question on the C-section video. Can scar tissue be removed with plastic surgery? So we have an entire video on C-section incisions and scars. So please check that out. We'll put that into the description. But some people's scars kind of form a keloid. So this is like a thicker band that kind of goes on the top. Okay. So first of all, I'll tell you, if you're not sure you're done having children and you've had a C-section and it's keloided over, do not let anybody touch it. Okay. Just leave that there for now, because if you talk to your OBGYN at the next time that you're pregnant, I've seen a lot of OBGYNs just take that off as they're sewing you back up. And to be honest, that's probably better at that time anyway. Okay. So if you're planning on having more if you're planning on having more babies, or you're not sure, don't do plastic surgery in between. Okay. Now, if you're sure you're done having babies, let's say you have a tubal ligation, let's say your partner has a vasectomy, whatever the case is, if you're sure you're done, absolutely, you can have surgery with a plastic surgeon to have that removed. That being said, if you normally form keloid scars, you are probably going to form something like that again. So I would recommend that you get not one, but 2 plastic surgery consults before you decide that you're going to try to get that removed. So you understand your options and you understand what the risks are and whether you might keloid again, because you don't want to spend a lot of money on a surgery just to end up with the same thing. And sometimes the next time it scars over, it'll actually be worse. You may also want to talk to your dermatologist ahead of time, because the dermatologist can't perform that surgery. So they don't have any vested interest to get you to spend money on a surgery. And they may be able to also guide you on understanding your skin and whether you potentially could scar again. All right. So we had a question on breastfeeding while pregnant. My milk has diminished greatly, and I cannot satisfy my 8-month-old's needs. I feed him real food, but he wants breast and bottle. I'm about 3 months, pregnant, give or take. Should I wait it out until my milk comes back, or will it ever come back, or should I give up and buy formula? So first of all, I think this is a great question. Breastfeeding while pregnant is safe for most women. So just for anybody who did not know that, you can absolutely breastfeed while pregnant unless your healthcare provider has told you have some kind of contraindication. So first of all, what is very common is once you get to be about 3 or 4 weeks pregnant, whether you're breastfeeding or not, your body starts making colostrum. Colostrum is that first milk that's designed for a newborn, that's full of all those antibodies and all that good stuff. But it's very small in quantity. And even if you've been making a full milk supply, your body may switch over into colostrum, which then means the baby that you've been breastfeeding is not getting enough milk at the breast. One of the ways you can figure out if this is happening is you watch for pees, for poops, you watch to see if the baby's losing weight, etc., or if the baby's very irritable and is not feeding well. If this happens, you will probably need to switch to some kind of external milk like formula. However, one of the things this mom said, and I want to make sure that I clarify this, she mentions, or should I give up and buy formula? I want to tell you, if you are listening, that I don't consider this to be you giving up. Your body is responding normally and naturally to making milk for a new baby that's inside your belly. It's not like you wanted to stop breastfeeding. This is just a natural process that's happening to your body. It's very hard to be taking care of an 8-month-old and be pregnant. So if you decide to get formula, which I would encourage you to do so, you're not giving up. You're simply following your body's lead, and your body's saying, hey, I need to focus on making the milk for this new baby. And your other baby's going to probably do just fine on formula. Lots of babies get formula. I'm very pro formula. Just go with it. But you're not failing in any way. You didn't give up. You wouldn't be asking the question if you had just given up. You could have just easily bought the formula. So don't beat yourself up over this. This is just you're following your body's lead and doing what your body's kind of naturally asking you to do. Okay. But I definitely think at this time you would want to start giving some of that formula. Okay. We had a question on urinary tract infections. I'm 30 weeks pregnant and I have vaginal itching. My doctor prescribed Monoryl fosfomycin sachet, 8 grams. Is this safe to use during pregnancy? So this was an interesting question. Monoryl is used for urinary tract infections, and it is something that we do see used. We don't use it as commonly over here. However, this is a great example of if you're not sure, if your gut tells you, I'm not sure, ask for a second opinion. So monoryl, in my the way I've known it to be used safely is 1 gram to 3 grams. Now, at the 1 gram to 3 gram dosing, the evidence says there's probably no risks to the baby. However, studies in rats and rabbits have shown that at higher doses than 3 grams, there have been some evidence of birth defects. However, this has also not translated to humans. These are animal studies. So the thing is, I am going to tell you, you probably need to go back to your healthcare provider and have a discussion with them. Because this dosing, if it was written correctly, I cannot say whether it is safe or not. What I can say is using 1 gram when the benefits outweigh the risks is, generally speaking, considered okay for pregnancy. So this is a great example of make sure you guys are checking it out. For those of you who are joining, please feel free to put any of your questions into the chat. I'm just hitting away at some of the questions that we've gotten on the videos. We had a question. Bleeding. It said, I'm 18 weeks pregnant and I noticed some blood clots while I was peeing and then it stopped, but then it came back again. But the second time there was no pain, no cramps. She went to the doctor. They did an ultrasound. The baby seems fine. The placenta is fine. They're not sure what caused the bleeding. Could you please let me know if this is something that I should be concerned about? So unfortunately, once you get there are times that I've seen in the second trimester where all of a sudden we get random bleeding with clots, and we're not necessarily sure where it came from. Sometimes it is still caused by sex. Sometimes it's caused by cervical irritation, like a inflammation of the cervix. Sometimes it's an infection that comes and goes. I would tell you that hemorrhoids are a common cause, that women think the bleeding's coming from the vagina and it's really coming from the anus. Right now, you did what you can do, but unfortunately, it's speculation only as to what was the cause. What can you do to prevent it? You want to keep yourself healthy and you want to make sure that you're not overdoing it. So we have a video on bed rest. And one of the things I think women try to do is put themselves on bed rest, and that's not a good idea. Laying around can actually put you at risk for pneumonia and blood clots. But at the same time, you don't want to be overdoing it. You don't want to be carrying around heavy baskets of laundry. You don't want to be lugging groceries up the stairs. Ask for help, okay? You want to make sure that you're doing things that you need to do, but within reason. If your body's telling you to rest, make sure you're resting. These are all very important for a healthy pregnancy. We had a question this week on Braxton Hicks contractions. I'm getting told by my doctor that I'm having contractions and will continue to have them throughout my pregnancy. I'm 28 weeks, but after hearing about Braxton Hicks, I'm 100% convinced that's what they are. So I'm so confused. Why wouldn't I be cleared to fly if I'm just having Braxton Hicks contractions? It makes no sense. So a lot of women need to have clearance in order to fly in an airplane, especially once you have a certain size belly. Some of the airlines will even require you to have some kind of medical note. So what I'm going to tell you, though, is that traveling is extremely stressful on the body. And I cannot tell you how many women I took care of over my career that were from another country or another state, because we have something called baby moons. I am completely 100% against baby moons. So any of you guys who are pregnant and thinking about doing one of these trips, I am completely against it. So why am I against it, you ask? Let me tell you. So a baby moon is supposed to be this honeymoon, this kind of trip where you guys get to go and enjoy, one last trip before a baby comes. Okay. What do trips involve? Trips involve going to exotic locations where half the time you're in a different time zone. So your body's like jet lagged, right? You're not eating good food. Yes, the food may taste good, but it's all restaurant food. So it's high in fat, it's high in salt, it's all sorts of stuff, right? You're sleeping in other people's beds. Hotel beds, sure, but the pillows are uncomfortable, the mattress isn't what you expected, etc. Okay, you're going. If you just spent a whole bunch of money to go to Canada for the first time or Italy for the first time, you're not going to sit in your hotel room for 8 hours a day. You're going to be out walking and walking and walking, which means you get dehydrated. Dehydration is one of the number one causes of Braxton Hicks contractions. Okay. And then let's talk about sex. It is a baby moon. If we think about our honeymoons, on honeymoons, there's usually a lot of sex. Baby moons are no different. And if you're having good sex, you are hopefully having an orgasm. Orgasms release oxytocin. Oxytocin is the same hormone that causes uterine contractions. Okay. So these uterine contractions, we talk about Braxton Hicks contractions as being mild. I do need to tell you, they are practice contractions. If you have enough of them, they are doing the same thing labor contractions do. So when you have this contraction, what it does is, this is our cervix, remember, right? Uterus. As the uterus contracts, it kind of pulls at that cervix. That's its job. And over time, as it pulls, we get this. And eventually we thin out. Okay. That's what those contractions are doing. Braxton Hicks contractions can do it just as well as a regular contraction. Furthermore, if you stimulate the cervix enough, you will release prostaglandins. So what happens is the amniotic sac can kind of sit on the edge of your uterus. So if any of you guys are familiar with when they strip your membranes, what they're doing is, if you get dilated enough, they go in there and they sweep their finger underneath to separate the amniotic sac from the wall. That's why it's kind of uncomfortable. That releases a whole bunch of prostaglandins, which are hormones that say to your body, hey, it's time to have a baby. So back to our Braxton Hicks, if you're dehydrated, so your Braxton Hicks have picked up, if you're producing tons of oxytocin from tons of sex, then your uterus is just going crazy wacko. And in the meantime, other things that might have stopped this, like sleeping and eating right and all this other stuff, aren't happening because you're go. You can stimulate preterm labor. Okay, if you stimulate it enough and your water breaks, guess what? Wherever you are is where you are now going to be having your baby. You cannot get on an airplane. You cannot get on a boat. You cannot get on a train. You shouldn't even get in a car for longer than it takes to get to the nearest emergency room. So once that actually officially happens, you're stuck. In my career, we once took care of a woman who was from Europe. She was in our hospital for 6 months. She was with us for 2 months pregnant, and 4 more months after her baby, who was born premature, had to stay in the NICU and graduate. So she was here for 6 full months away from her family in Europe because she had come on a baby moon. So why did your doctor say you couldn't fly? Very likely because they felt you were having enough Braxton Hicks contractions, or there were other risk factors that they thought there was a possibility that flight might be an issue for you. So I would take their advice. If they're not comfortable telling you can fly, I would just listen to them. There's got to be a reason. We're almost done here. So I have one more question. It kind of goes along with the mucus plug and cervix. I started losing my mucus plug 3 days ago. I'm 40 weeks, but I've had no labor pains. My baby's head was not fixed, but now it is, and the cervix has started to dilate. So I think what she's kind of trying to say is that the baby's been moving around a little bit, and so she's wondering why labor hasn't really started. Your mucus plug will go, you dilate just a little tiny bit, and the mucus plug will drop out. And some women don't even really have this distinct mucus plug, so you won't even notice if it comes out. Just because your mucus plug comes out does not mean you're starting labor. It just means that you've dilated a little bit. So if the baby's head is still floating and engaged on the cervix, you may not really start labor right away. So one of the things you can look at is maybe some of the tricks that we have for encouraging labor to start. We have a video on that. And you can ask your healthcare provider if there's anything else you can do to kind of stimulate that process to go. All right. So for those of you stuck to the end, turns out that my last question is a question that has to do with tomorrow's video. So the question was, can baby aspirin help with my blood pressure? So unfortunately for the viewer who asked that question, I would like you to check out tomorrow's video. Tomorrow's video, we're going to be talking about baby aspirin and all of why we use it, why it's so important, whether you should use it or not use it, because some people should not use baby aspirin. So everything you wanted to know about using baby aspirin, that comes out tomorrow. And we try to bring out videos for you every Tuesday, so please check it out. I like to encourage you guys to know that there's some good stuff coming out. So I'm just going to give you some hints. You know, some of you guys have been asking about RSV vaccine. Maybe you want to know about Botox. Maybe you want to know about tanning. So maybe you guys should keep your eyes out. So please subscribe to the channel. It really, really, really helps me out. Please hit the notification bell. That way you know when some of these exciting videos are coming out so you can be the first to check it out. I'm Dr. Samantha. I'm the maternity mentor. I'm here every Monday at 9 p.m. Eastern Standard Time to answer your questions live, as well as questions that you put onto my videos or in social media. We link all our social media below. Please understand, if you put questions or suggestions onto the videos, I am the one looking at it and I do answer. We take this very seriously. I'm very passionate about supporting you guys, supporting your families. So please share this channel with friends, family, coworkers, whoever you think might benefit. I really appreciate all of your support. Thank you for being here again. My name is Dr. Samantha. I'm the maternity mentor. Bye for now.